today we are going to be talking about the feeding controversy between breastfeeding and formula. So in media, we can typically see that feeding a child is portrayed through a bottle. These were the first 3 images that came up when I searched for infant feeding, and as you can see, breastfeeding isn't shown until the 3rd photo. So why is there formula now when mothers have breastfed for ages? Interestingly, the media has more power on our actions than words do, and so seeing these photos and these videos actually reinforces this behavior amongst mothers. So historically, there have actually been a lot of steps that have led to formula. In one specific study, lots of ancient techniques are talked about that helped mothers to lactate. So this one study in particular talks about a method used in ancient Egypt for lactation failure. And this was mentioned actually in the medical encyclopedia known as the Papyrus Ebers, which was from Egypt in 1550 BC. And the prescription for lactation failure is to get a milk supply in a woman's breast for a suckling child, warm the bones of a swordfish in oil, and rub her back with it. And then it continues and gives a couple other very interesting techniques to help a mother lactate. So as we can see, it was still a struggle then. It wasn't perfect. They didn't have it figured out, but they figured out what worked for them, which I think is really important for us to keep in mind, because everybody is going to have different things that work for them. If you look down at the bottom of this study, it talks about what they would do in ancient Greece in 950 BC, and women of the higher social class would typically get wet nurses. So, a wet nurse is a female who would come to the home. Sometimes she would stay there depending on the wealth of the family, and she was kind of just like a nanny to their children, but she would feed them. And so again, this was for the higher social class. A lot of the lower social classes couldn't afford this and kind of had to figure it out on their own. So in 1865, a remedy for this was presented by chemist Judas von Liebig, and he proposed the world's first baby formula, which was made of cow's milk, malt flour, wheat, and potassium bicarbonate. And ever since, the world changed. So this made it a lot easier for everybody who couldn't afford wet nurses and who was having problems with breastfeeding. So ever since formula feeding has become more common, we can see that a lot of people are using it kind of just because. So in this one study, the role of healthcare providers in encouraging formula feeding in Mosul City, they had a camp with refugees, and they were talking about formula and when to use formula versus when to breastfeed. And amongst the females who used formula for their babies, they asked them what pushed them to make that decision. And 73% of them answered saying that it was a professional encouragement to do so. So their doctors recommended it, research recommended it, and then 27% said they used it for other reasons. And of course, these reasonings are different for everybody, but some of these reasonings might include the convenience. Feeding with formula also allows us to know exactly how much the baby is eating, which can be a very common concern amongst newborns. It is also quickly prepared and easily stored. It makes for more sleep during the night and less stress during the day. It's also easier on the female's bodies. It avoids pain. And in a study of moms in the hospital who had just given birth to their children, 219 of them only used formula to feed their infant in the hospital. So in the hospital, their child only consumed formula. And this goes on to say, when all survey respondents were included, almost 95% initiated breastfeeding while moms were in the hospital right after birth. which is very interesting because the World Health Organization actually strongly recommends that infants aren't given formula until they are at least 6 months of age. So it's very crucial to their development to have breastfeeding milk. Formula is a monthly average cost of $100 to $150 per month, which adds up to $3,600 per child if you fit within that average, because each baby will typically breastfeed or formula feed for at least 2 years. So interestingly, there's an argument that breastfeeding is more expensive, and you can see here that there are a couple studies that have been done claiming this. So there's this one from Yale School of Medicine that says a year of breastfeeding can cost up to $11,000. So why might this be the case? This is typically the case because the tools that are needed, there could be creams needed. Maybe a mom needs more food and more nutrients to be able to lactate. And maybe she needs therapy. Maybe she needs all these different resources to help her get there. So the cost is going to vary from family to family. But interestingly, a lot of studies talk about the breast milk benefit and the formula hazard. So we really don't know a lot still about the effects of formula on a baby. But those who know more about formula tend to use formula, while those who know more about breastfeeding tend to rely on that. So as a mother, we know that it gets hard, and self-care is really the key to this. So a couple of studies actually talk about the necessity of this. Milk composition might be altered by maternal psychological distress and have an impact on lactation and breastfeeding success. And then again, a recent study suggests that strengthening breastfeeding confidence during lactation consultations may reflect in the improvement of the woman's mental health. So the better the mental health is, the easier of a time the mother will have lactating. These are some pictures of my nephew. I wanted to include him in my presentation because when he was born, he was actually tongue-tied. And he was passed up by 3 pediatricians and a lactation consultant, and they all said he was fine. But when he would feed, he'd only get about 0.3 ounces of milk before getting tired and falling asleep, but he was supposed to be drinking 3 to 4 ounces. So eventually with time, they found out that he was tongue-tied. He got a procedure and went to physical therapy and chiropractors to help with this. But they ended up finding out about myofunctional therapy that helps him be able to latch on and to get the milk that he needed. So, of course, there can be obstacles to breastfeeding, but there are always different solutions that we can find. So some of the benefits of breastfeeding, actually, interestingly, formula is commonly associated with a long-term change in body composition. So for breastfeeding babies in the beginning, they tend to have a greater fat mass up until they are about 12 months of age, and then the formula-fed babies have a greater fat mass. So that's just really interesting to see how that flips there. And then down at the bottom of the page, it says, not breastfeeding is associated with an increased risk of poor health outcomes and premature death. So the nutrients that babies get out of breastfeeding milk is very important. So we've come to the end of this presentation, and now we're asking, now what? I would just like to end with these 2 citations. When mothers breastfeed, their brains produce oxytocin, helping them feel more bonded to their infants. Additionally, that oxytocin is passed through the milk to the infant, helping the infant feel more bonded to their mother. So there truly is this bonding that happens with breastfeeding. So it takes time, it's a sacrifice, but it is a bonding that happens. And typically, formula feeding is more convenient, but in the end, it really is between conveniency and bonding with your baby. And of course, that is going to fluctuate depending on your own personal needs.